I think that nurses, there's been mounting exhaustion, mounting unrest. We are moving toward a place in our careers where we're feeling a large degree of moral injury in that we've been abandoned.
Deborah Lefebvre, who also hosts a podcast called 1RN, 1MD, says that nurses on the front lines are feeling the impacts physically and mentally because of COVID-19. This has resulted on a call out against all levels of government for lack of funding. Lefebvre says it's led to low staffing rates, an unfair Bill 124, which suppresses their wages, and a lack of resources.
At the hospital level, and I think this is a rather widespread issue, there's not much, Brandon, by way of mental health resources and supports.
According to the Registered Nurses Association of Ontario, nurses are feeling overworked and undervalued. In fact, the RNAO surveyed 2,100 nurses, and 13% said they would likely leave this profession.
The survey was a shocking call, more than a wake-up call.
The RNAO does provide resources and consistent mental health checks for nurses. However, they say that the Ontario government needs to do more. The vaccine rollout is a major sticking point for them.
While the Premier is working from his home and I'm working from my home, so is my staff at RNAO, for us to have one shot is not a problem. But those RNs and those are respiratory therapists and those cleaners and those dogs that are working in ICUs with COVID positive patients and are 12 hours, the nurses in particular, they don't come and go from the room. They're 12 hours exposed to patients with COVID positive. It is absolutely devastating for us to know that they have not received their second shot.
Again, the RNAO says they will continue to keep mental health top of mind for nurses, but are calling on the government to step up. They also are asking people to support nurses during Nursing Week, which starts Monday, and you can find more information by heading to their website. In Toronto, I'm Brandon Rowe for City News.